everyone, and welcome back to Health First. Today I'm here with Dr. Joyce, who is a general dentist and the owner of Caramel Distinctive Dental. Hi, how are you?
I'm doing great. How are you doing?
I'm great. Thank you for joining me here today.
Thank you.
I would like to start off by asking, what influenced you to pursue a career in dentistry?
So I had a cheerleading accident in middle school that I ended up falling face first, and I had to have a lot of dental reconstruction on some of my front teeth, and it also led me to having I had orthodontic braces that actually helped splint my teeth from the trauma that actually probably saved my teeth. So I sat in the chair so many hours that I said, you know what? I would rather not sit in this chair. I'd rather be on the opposite end of it. So my senior year of high school, I decided to do a dental assisting program where I would go half days. And that's when I really knew that that was what I wanted to do.
And can you tell me a little more about what you do and like your profession?
Sure. So on a day-to-day basis, during the week at least, I'm seeing patients and I'm either doing fillings, crowns, Invisalign, checking exams. I am also doing cleaning sometimes. Because of the pandemic, we have a hygiene shortage, which I am sure many people are aware of. There's just employee shortage, I should say. So that is my day-to-day on the dental side. On the administrative side, as an owner, I am doing accounting, payroll. I'm trying to think what else that I do. I am always on the go or doing CE courses just to stay up to date with the technology. And as a business owner too, I'm always making business decisions. So this week I'm actually changing my phones to a new phone service that I made the decision about a month ago. But that's a process in itself, because as a business owner, you have to do what is best for the practice, also while keeping expenses low.
Yeah, definitely. And what do you like most about your profession?
I really enjoy the patient interaction. I really love the fact that I get to see multiple generations in a family. So I get to see grandparents, children, and grandkids. And they always tend to book their appointments the same day. And it's adorable because they like pass each other and they're like, what are you doing here? So I really enjoy that. And honestly, just treating patients like family. I had a patient text their office to like wish me well on my vacation. That is like so sweet. And, that's just very nice of them to even think about me. So
Yeah, definitely. That's great. And throughout the years, many new technological innovations have been developed in dentistry. Have you adopted any of these in your practice?
yeah, so the most recent product that I've been using has been this curing light. The light actually hardens the filling. And now they came out with a new light that is only 3 seconds. And so it is less time in the patient's mouth. And it also doesn't heat the tooth up for a long period of time. So that also helps, but it really, really helps with the kiddos, because kiddos tend to, be extremely nervous at the dental office. And so the less time that you're working on them, the easier it is for them to overcome that dental anxiety.
Yeah, definitely. And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
Yeah, so the first couple months, I actually didn't see my extended family. It was extremely challenging because, as you know, dentists are in a higher risk category due to aerosols. And so because of that, this was obviously before the vaccine. And so just to be on the safe side, I was protecting myself and my family by not spreading anything, flattening the curve. And then I also wanted to make sure that I was safe for my patients, because we have a lot of patients who are medically compromised. And so, just limiting what I was doing outside of the practice was a huge thing for me. I would go to Costco like once in like every 2 months, try to, just prevent anything like that. Now, in regards to the dental side of it, it has been extremely challenging. We have been seeing things that I never thought that I would see in my career. We are seeing grinding and clenching that has caused people to just shear off their tooth because the stress that they have at home has really caused them to do that. And I, wholeheartedly believe that a lot of it is the COVID-19 has caused that stress. And the other thing that we're seeing too is a lot more pathology than I have anticipated to see. And we have seen long-term lasting COVID-19 effects on patients that my patients are asking me, what can they do? And, it is very critical, the vaccine, for those that can receive it, that, I have patients who, ask me questions about the vaccine, and I really stay up to date. I just found out, 15 minutes ago, the FDA approved. So I'm really excited. Today's a big celebration, at least in my office. So for that, because it is, something, even as a dentist, that, we have a duty for healthcare to help patients. So.
Yeah, totally. And to end off, can you give a few words of advice to the people of my generation hoping to pursue a career in dentistry?
Yeah, definitely always follow your dreams. You can do anything as long as you put your mind to it. Never have a doubt in your mind that, you can't do something. I'm going to tell you right now, I may not have been the, A+ student. I worked my tail off, but the reward at the end of the day is this is exactly what I wanted to do.
Mhm.
The other advice would be definitely shadow. Do as much shadowing as possible to find out if dentistry is the career that you want to be in. Because if you love what you do, it is not work. You don't go to work every day. You get to go and enjoy exactly what you went into this profession for. So that would definitely be my 2 pieces of advice. But my third one would be, I was told this by an oral surgeon, and so I'm going to pass this on the ABCs to get into dental school. A's open doors, B's keep doors open, and C's close doors. But don't think that C's will not get you into dental school. You just have to make sure you retake that class.
Yeah, thank you so much. And those are all the questions. So thank you for joining me and thank you for your time.
Yeah, thank you so much.